Well, good morning. My face feels so crazy. It is the day after Thanksgiving, and I'm meeting Sonya, our lead esthetician, up here at the office to do a little laser resurfacing on my face. And it feels like my lips aren't even moving. So I've got a little numbing cream on my face, and I'm gonna take you through this process. So we're doing a little laser resurfacing to remove some lines, wrinkles, but also some sunspots. I live in the sun, we're at the lake all the time. I ride road bikes. And so I'm literally in the sun like all the time. And so this is gonna kind of reverse a lot of that. We've got some dysport in my forehead and in between my eyebrows. And so we'll be good to go from that standpoint. So I'll take you through a little bit of this, maybe shed a little light on these treatments. All right, we got everything all clean and prepped and ready. This is cold air. It's quite cold, wow. So I'm not numb down here, but I don't feel how cold it is on my face. It's crazy. All right, goggles are going on. Here we go. I don't feel that like one bit. Not one bit.
And you were nervous.
I was a little nervous. And that is a 2 out of 10. Seriously.
Okay.
Okay, so we just finished up the treatment. Sonya did such a nice job. So now, for maximum quickness, effectiveness, and quicker recovery, we're going to do exosomes, okay? So this is a special blend. If you're getting laser in our office, and we didn't talk to you about this, make sure you ask about it. Tell you, I was ready for it to be like kind of rough. It was not rough, and we did pretty decent settings, wouldn't you say?
We did, yeah, pretty strong settings. You did great.
Yeah. All right, Sonya, can you tell us a little bit about these exosomes? And
Exosomes are just going to make you heal faster. So some stem cells, growth factors, increase that healing capability.
I can smell them.
You can?
It's interesting, yeah. Never smelled them before. It smells like faster, more effective healing. So this works very well with laser in our surgery center or a laser in the med spa, right? With you?
Yes, microneedling laser.
Feels nice rubbing it on there. And so I know what to expect, but what would you tell me what to expect over the next 2 to 3 days?
Some dry, very dry, tight, kind of crusting on the skin. A little heat. You're going to definitely feel some heat over the next 24 hours.
Come. And I'm somebody, I'll get a cold sore if I like bite my lip or my gums or something. So I've been taking the acyclovir, and we'll continue that.
Put you under some red light for a minute.
So here comes the red light. Boom. All right, here in my bathroom, getting ready for bed, and I've taken my acyclovir, check. I've washed my face, and I've put the ointment on, so we are all set to go. Now, I'm gonna put a towel over my pillow so that I don't get ointment all over my pillowcase. All right, we are day 1
about 24 hours after my CO2 laser resurfacing. And I want to tell you a little bit about what I'm experiencing, what I'm feeling. And really, I'll tell you, it's not nearly as bad as I thought it was going to be. My face feels like I've got a pretty good sunburn. I can't like open my mouth real right or like change my expressions a lot because it feels like my skin is like caked, like stiff. And things are now a little bit swollen. I just got out of the shower. But feels great. So been cleaning it, keeping the ointment that we prescribe in place. And I'm really excited to see the results. So, also people are like, well, what's the downtime? What's the recovery? Let's talk about recovery. Let's talk about kind of what it's been like. Well, yesterday I got it done. I came home, did a couple things around the house, just watched some football, normal family stuff. This morning, got up, made the kids breakfast. Actually, it was more like quality control for breakfast pancakes and supported my wife as she made them. But then we put the tree together and did a bunch of stuff. I did kind of a mini workout. I don't want to like make my face sweat, but workouts and kind of getting your heart rate up is totally okay. Sleeping was a little tricky because the ointment's on your face, and so you just don't want to get it all over your bed and your pillowcases and all that stuff. So I've got some tips coming on that. All right, so now I've got the ointment in place and I'm nice and shiny. Here we are, day 1. The balm gets in your hair a little bit. It's okay. Rocking and rolling. All right, so we're looking at day 2, maybe about 40-ish hours right after laser resurfacing. Check it out. Okay, we are day 3. Saturday, Sunday, Monday. Day 3 after CO2 laser resurfacing in our med spa. And I want to give you a look at what it looks like. So I've got a little bit of flaking, a little bit, but overall starting to look pretty good. My face is feeling less tight. Things are healing very, very well. And so to recap, I pre-treated my skin with some medical grade skin products that our team will tell you about. Then we had the legit laser. I was awake in our med spa. We've got the most high-tech technology to keep things comfy as far as that goes. And then I've done exactly what the prescribed treatments have been. And so the prescribed treatments after the laser procedure are going to be to keep some certain skin medicines going on your face to keep things nice and clean. And then also I've added in some red light therapy along with some hyperbaric oxygen therapy, something that may not be available to every person, but I think it's really made a big difference. So I'm no longer red, just a little bit flaky. And so I am in now the moisturization phase. So we're rocking, we're rolling. This has been awesome. Really excited to see the final outcome on my skin, so stay tuned. All right, we are exactly 1 week after my laser resurfacing. So if you look closely, see a little bit there, a little bit on my nose, a little bit on the forehead still. My skin overall feels super smooth, like crazy silky smooth. Still just a couple places, but for about 2 days now, I've been able to be totally fine. And people are like, oh, you had laser? So they have no clue. So that was the deal.